In this demonstration, I'm going to chart an established patient visit with the complaint of chronic cough. First, I'm going to select the chronic cough template. All of these templates can be modified based on user preference. This template allows you to create and select pertinent historical positives and negatives, as well as pertinent descriptors to describe the location, quality, severity, timing, and content of the symptoms. After making the selections from a template, you can chart additional history. Of course, if you don't want to use a template for your history, you can use many other charting tools, including keyboard, voice recognition, text micros, transcription, or handwriting recognitions. The review of systems from the last visit defaults for this visit. If you want to start with a clear document, you can select Clear All Fields button and then begin charting the pertinent positives and negatives. Now let's chart the physical exam. Findings from the last visit pre-populate this section. In this case, the physical exam findings are the same as the previous visit, but the impacted wax was removed last visit. I'll change the otoscopic exam to be normal. A review of the medications page shows that there are no current medications like the ACE inhibitors that may be contributing to the cough. Now I'll chart the service coding and the laryngoscopy. When I add the laryngoscopy as a procedure, it charts the findings in the encounter note, and it also sends a CPT code along with the service code to the billing system for claim submission. For the laryngoscopy, you can see standard text describing the procedure. As I chart my assessment and plan, the previous encounter ICD-9 diagnosis code, along with the plan details, pre-populate this note. They can then be deleted or modified depending on the circumstances. First, I'll remove the previous encounter's diagnosis of unspecified hearing loss. Then I'll change the wax impaction status to be resolved. My diagnosis is Gastroesophageal Reflux Disease. For this diagnosis, we have educational content, for example, a reflux regimen associated with the diagnosis code. Patient instructions and educational links can be automatically sent from the system via an email to the patient after the visit, streamlining the process of patient education. Alternatively, patient instructions can be printed while in the exam room or at patient checkout. In this case, we can free-form fill out the plan for this patient, as we have not entered a default or templated plan in this scenario. If the plan I have entered can be appropriately used for other patients, then I will make the content I have entered a default plan. By pressing the green D button, the next time I select GERD as a diagnosis, all of the plan content will appear for the next patient encounter. Now let's write the prescription for Nexium and electronically send this to the pharmacy. I see my list of drugs I frequently prescribe, but Nexium is not on the list. So I will just enter in the first few characters of Nexium and see the list. The standard SIG is automatically inserted. Now I will automatically send the prescription to the pharmacy of the patient's choice. Now that the prescription was automatically sent, the patient goes to the pharmacy and just picks it up. When I click View Note, I can see the final note. Finally, I can sign the note and complete the encounter. This encounter demonstrated some of the quick charting tools available in the waiting room solution system.